This tiny difference in a baby's head can decide whether labor is normal or becomes dangerous. Two babies can weigh the same. Two mothers can have the same pelvis, but one delivers safely, and the other develops obstructed labor. The difference is not the baby's weight. The difference is the fetal head. Today, I'll show you how the baby's skull, especially the head diameters, decide whether labor progresses or suddenly becomes life-threatening. On this channel, I explain pregnancy and labor simply. No unnecessary theory, no confusing diagrams, just what you need for exams, clinical practice, and safe patient care. In this video, we're focusing on the fetal skull, because most labor problems start at the baby's head, not the uterus, not the pelvis, but the head. The fetal skull is different from an adult skull. It is not one solid bone. It is made of several bone plates joined together by sutures and fontanelles. These spaces are not a weakness. They are a design advantage. They allow molding. Molding means the baby's head can change shape slightly as it passes through the birth canal. Without this flexibility, normal vaginal delivery would be impossible. Key point: flexibility of the fetal skull is essential for birth. Now let's talk about fetal head diameters. A diameter simply means the distance between 2 points on the baby's skull. Different head positions produce different diameters. Some diameters are small, some are large. And during labor, the pelvis does not care about names. The pelvis only cares about size. If the diameter is small, labor progresses. If the diameter is large, labor slows, then stops. Here's the most important rule you must understand. If the baby's head is flexed, the smallest diameter presents. If the baby's head is extended, the largest diameter presents. Flexion brings the chin toward the chest. Extension lifts the chin away from the chest. This one movement alone can decide the outcome of labor. Key point: flexion equals safety. Extension equals danger. When the head is well flexed, the smallest diameter is called the suboccipitobregmatic diameter. This is the diameter seen in normal vertex presentation. It passes through the pelvis easily. When the head is partially extended, larger diameters appear, like in brow presentation. When the head is fully extended, even larger diameters appear, as in face presentation. These large diameters are strongly associated with obstructed labor. Large fetal head diameters do not just delay labor, they cause prolonged labor. Prolonged labor leads to maternal exhaustion, uterine rupture, fetal distress, and emergency operative delivery. This is why midwives and nurses must never ignore slow progress. Labor obstruction often starts quietly, but ends dramatically. For exams and practice, remember just this: flexed head, smallest diameter, safe labor. Extended head, largest diameter, danger. If you know this, you can predict labor outcomes before complications occur. As nurses and midwives, your role is early recognition. Observe labor progress. Recognize abnormal descent. Report early, because obstructed labor is easier to prevent than to manage. I'm Nurse Succinate. On this channel, I explain pregnancy and labor simply. Watch the next video where I explain fetal head versus pelvis, why labor succeeds or fails.